Testosterone is the primary male sex hormone and an anabolic steroid often used medically to treat low testosterone levels. When misused for performance enhancement, it can disrupt the body's natural hormone balance. Exogenous testosterone suppresses the hypothalamic pituitary gonadal axis, which can cause the testes to shrink and sperm production to drop, sometimes permanently. Cardiovascular risks increase due to elevated red blood cell counts, which can thicken blood and increase clotting risk. Users may experience severe acne, hair loss, liver stress, especially with oral forms, and gynecomastia due to estrogen conversion. Psychologically, testosterone misuse can lead to mood swings, aggression, irritability, and in some cases, depression when stopping use. Long-term misuse also increases the risk of heart disease and stroke. Legally, non-prescribed testosterone is controlled in most countries, with potential criminal penalties for possession or distribution without a prescription. Trenbolone is a highly potent anabolic steroid originally developed for veterinary use to increase muscle mass in livestock. In humans, it is notorious for its extreme side effects and health risks. Cardiovascular strain is significant, with users experiencing elevated blood pressure, cholesterol disruption, and increased risk of heart attack or stroke. Trenbolone is strongly androgenic, which can cause severe acne, hair loss, oily skin, and accelerated male pattern baldness in predisposed individuals. It also has a high propensity to suppress natural testosterone production, leading to testicular atrophy, infertility, and long-term hormone imbalance. Neuropsychiatric effects are pronounced. Users frequently report anxiety, insomnia, aggression, paranoia, and in extreme cases, hallucinations or depression during withdrawal. Liver toxicity is lower than some oral steroids, but still a concern with prolonged use. Trenbolone use can also cause night sweats, severe sweating, and kidney strain due to its impact on nitrogen retention and fluid balance. Legally, it is classified as a controlled substance in many countries, making non-medical use illegal. Decadurabolin is an anabolic steroid derived from testosterone, commonly used for muscle growth and joint support in medical settings. When abused for performance enhancement, it carries several significant risks. One of the most prominent side effects is hormonal disruption. Deca suppresses natural testosterone production, potentially causing testicular atrophy, reduced sperm count, and long-term infertility. It can also convert to estrogen in the body, leading to gynecomastia, male breast tissue growth, and water retention, which may mask fat loss progress and strain the cardiovascular system. Cardiovascular risks include elevated blood pressure, altered cholesterol levels, and increased risk of heart disease over prolonged use. While Deca is considered milder on the liver than oral steroids, hepatotoxicity is still a potential concern if stacked with other compounds. Users may experience joint pain, fluid retention, and injection site reactions. Psychiatric effects, although usually milder than more androgenic steroids, can include mood swings, irritability, and depression during withdrawal. Non-medical possession and use of decadurabolin is illegal in most countries. Equipoise is an anabolic steroid originally developed for veterinary use to increase muscle mass and appetite in horses. In humans, its misuse carries significant risks. Equipoise strongly suppresses natural testosterone production, which can lead to testicular atrophy, decreased sperm count, and long-term hormonal imbalances. Cardiovascular side effects are common, including elevated blood pressure, unfavorable cholesterol shifts, and increased risk of heart disease and stroke. Androgenic effects such as acne, oily skin, hair loss, and body hair growth are likely, especially in genetically predisposed individuals. Equipoise can also aromatize into estrogen, causing gynecomastia and water retention, which may place extra stress on the heart. Psychologically, users may experience mood swings, irritability, anxiety, and depression during and after use. Liver toxicity is relatively low, but prolonged use in combination with oral steroids increases strain. Legally, Equipoise is classified as a controlled substance in many countries, making non-medical use illegal. Masteron is an anabolic steroid derived from dihydrotestosterone, DHT, primarily used medically to treat certain types of breast cancer. In performance enhancement, it is favored for its muscle-hardening effects and low water retention, but it carries notable risks. Masteron does not aromatize significantly, so estrogen-related side effects like gynecomastia are less common. However, it is strongly androgenic, which can cause severe acne, hair loss, oily skin, and body hair growth. natural testosterone production is still suppressed, potentially leading to testicular atrophy, decreased sperm count, and long-term hormone imbalance. Cardiovascular health is affected, with increased risk of high blood pressure, cholesterol disruption, and heart disease, particularly when stacked with other steroids. Psychologically, users may experience aggression, irritability, anxiety, and mood swings. Injection site reactions are possible, and prolonged misuse can contribute to liver and kidney strain. Legally, Masteron is controlled in most countries, making non-prescribed use illegal. Anavar is a synthetic anabolic steroid derived from dihydrotestosterone DHT, known for its relatively mild anabolic effects and low androgenic activity. Medically, it is used to promote weight gain after severe illness, surgery, or chronic infections. Despite its reputation as mild, Anavar carries serious risks when abused for performance enhancement. It still suppresses natural testosterone production, potentially causing testicular atrophy, reduced sperm count, and long-term hormonal imbalances. Liver toxicity is a concern, especially with prolonged oral use, because Anavar is a 17-alpha-alkylated steroid, which strains the liver's detoxification processes. Cardiovascular side effects include elevated LDL cholesterol, reduced HDL cholesterol, and increased risk of heart disease over time. Androgenic effects, though milder, can include acne, hair loss in predisposed individuals, oily skin, and unwanted hair growth. Psychological effects can involve mood swings, irritability, and anxiety, particularly during cycles and post-cycle withdrawal. Legal restrictions apply. Anavar is a controlled substance in many countries, and non-medical possession is illegal. Dianabol is one of the most well-known oral anabolic steroids, originally developed to enhance muscle growth and athletic performance. It is highly anabolic, but also carries significant risks. Dianabol strongly suppresses natural testosterone production, which can lead to testicular atrophy, infertility, and long-term hormonal imbalance. It aromatizes readily into estrogen, causing gynecomastia, water retention, and bloating, which can mask fat loss and strain the cardiovascular system. Cardiovascular risks include elevated blood pressure, altered cholesterol levels, and increased risk of heart disease and stroke. Liver toxicity is a major concern, as Dianabol is a 17-alpha-alkylated oral steroid, putting prolonged strain on liver function and potentially causing liver damage. Androgenic side effects include severe acne, hair loss in genetically predisposed individuals, oily skin, and excessive body hair growth. Psychological effects can be profound, including mood swings, aggression, irritability, anxiety, and depression, particularly during cycles and post-cycle withdrawal. Non-medical possession and use of Dianabol are illegal in most countries. Anadrol is a highly potent oral anabolic steroid originally developed to treat anemia by increasing red blood cell production. Its misuse for muscle growth carries severe health risks. Anadrol strongly suppresses natural testosterone production, which can lead to testicular atrophy, infertility, and long-term hormonal imbalances. It aromatizes into estrogen, often causing significant gynecomastia, water retention, and bloating, which increases cardiovascular strain. Cardiovascular side effects include high blood pressure, altered cholesterol levels, and an elevated risk of heart attack and stroke. Liver toxicity is particularly severe with Anadrol, as it is a 17-alpha-alkylated oral steroid, and prolonged use can lead to liver damage, jaundice, or hepatic tumors. Androgenic effects such as acne, hair loss, oily skin, and excessive body hair growth are common. Psychologically, users often experience aggression, irritability, mood swings, anxiety, and depression during and after cycles. Non-medical possession and use of Anadrol is illegal in most countries. Winstrol is an anabolic steroid commonly used for cutting cycles to preserve lean muscle while reducing body fat. Despite its popularity, it carries serious health risks. Winstrol significantly suppresses natural testosterone production, potentially causing testicular atrophy, decreased sperm count, and long-term hormonal imbalances. Unlike some steroids, Winstrol does not aromatize into estrogen, so gynecomastia is less common, but it can still cause water retention and joint discomfort. Cardiovascular risks are significant, including elevated LDL cholesterol, reduced HDL cholesterol, and increased risk of atherosclerosis and heart disease. Liver toxicity is a major concern, particularly with oral winstrol, because it is a 17-alpha alkylated compound, which places prolonged stress on the liver and can cause liver damage. Androgenic side effects include acne, oily skin, hair loss in genetically predisposed individuals, and increased body hair growth. Psychologically, users may experience aggression, mood swings, irritability, and anxiety, particularly during and after use. Winstrol is a controlled substance in most countries, making non-prescribed use illegal. Halotestin is an extremely potent oral anabolic steroid derived from dihydrotestosterone, DHT, primarily used medically to treat male hypogonadism and certain types of anemia. It is one of the most androgenic steroids available, meaning it carries a high risk of severe side effects. Cardiovascular risks are pronounced, including elevated blood pressure, unfavorable cholesterol changes, high LDL, low HDL, and an increased risk of heart attack and stroke. Halotestin strongly suppresses natural testosterone production, potentially causing testicular atrophy, infertility, and long-term hormonal imbalance. Liver toxicity is significant because halotestin is a 17-alpha alkylated oral steroid, which can lead to liver damage, jaundice, or hepatic tumors with prolonged use. Androgenic side effects are extreme. Severe acne, oily skin, accelerated hair loss in genetically predisposed men, and excessive body hair growth. Psychologically, users frequently report aggression, irritability, mood swings, anxiety, and paranoia. Non-medical possession and use of halotestin is illegal in most countries. Clenbuterol is a bronchodilator originally developed to treat asthma in humans and respiratory issues in animals. It is not an anabolic steroid, but is often misused as a performance-enhancing drug for fat loss and muscle preservation. Clenbuterol stimulates the central nervous system and increases metabolic rate, but misuse carries severe health risks. Cardiovascular effects are significant. Users can experience elevated heart rate, high blood pressure, palpitations, arrhythmias, and an increased risk of heart attack or stroke. Long-term use may lead to cardiac hypertrophy, where the heart muscle thickens and loses efficiency. Neurological side effects include anxiety, tremors, insomnia, and headaches. Muscle cramps and electrolyte imbalances can occur due to excessive sweating and mineral loss. Clenbuterol does not suppress testosterone production, but its stimulant effects can stress multiple organ systems. Gastrointestinal issues, nausea, and vomiting are also reported. Legally, clenbuterol is banned for human use in many countries and is often classified as a controlled substance in sports due to its performance-enhancing properties. T3, or cytomel, is a synthetic form of the thyroid hormone triiodothyronine, prescribed medically to treat hypothyroidism. In performance enhancement or weight loss misuse, it carries significant health risks. T3 increases metabolic rate, which can accelerate fat loss, but excessive use can lead to a hyperthyroid state. Symptoms of hyperthyroidism include rapid heartbeat, palpitations, anxiety, insomnia, excessive sweating, tremors, and unintentional weight loss. Long-term misuse can cause permanent thyroid gland suppression, making it difficult to maintain normal thyroid function after discontinuation. Cardiovascular risks are high. Chronic overuse can lead to arrhythmias, high blood pressure, and increased risk of heart attack or stroke. Muscle loss and fatigue are common if caloric intake is insufficient while using T3. Bone density may decrease over time, increasing fracture risk. Psychological effects include irritability, anxiety, and mood swings. Legally, T3 is a prescription-only medication, and non-medical use is illegal in most countries, with additional risks in competitive sports due to anti-doping regulations. SARMs are a class of compounds designed to selectively target androgen receptors in muscle and bone tissue while minimizing activity in other tissues, theoretically reducing side effects compared to anabolic steroids. Despite this, SARMs carry significant risks. They suppress natural testosterone production, potentially causing testicular atrophy, reduced sperm count, and long-term hormonal imbalance. Cardiovascular effects include elevated blood pressure, cholesterol disruption, and increased risk of heart disease with prolonged use. Liver toxicity has been reported, particularly with certain orally administered SARMs, leading to liver enzyme elevations and possible hepatic strain. Androgenic effects, while typically milder than steroids, can include acne, hair loss, oily skin, and unwanted body hair growth. Psychological effects can involve aggression, mood swings, anxiety, and depression during use and post-cycle. SARMs are largely unregulated in many countries, and most are banned by professional sports organizations. Non-medical use can carry legal and health consequences.